stop the gastroparesis been getting worse. So when we are talking about the gastroparesis treatment, and I am going to take up the dietary management, so the first thing which comes into the mind is that if the patient has been under strict fasting and continuous GI decompression, then once the diagnosis has been clear that the person is suffering from gastroparesis, the gastric tube should not be removed rashly, and it has to be like a symptomatic relief needs to be seen in case of the patient. Second is we require intravenous rehydration to maintain the water and electrolyte and maintain the pH balance. Third comes the most important one is the nutritional screening and the assessment and the therapy to tailor-make the nutrition which has been provided to the patient, and we can use the different assessment and the screening methods like NRS or SGA for making out or leading to whether we need to go for a parenteral therapy or enteral can work for it. Then the most important one is that the diabetes, if the person is having diabetes, that needs to be corrected, hypoproteinemia should be corrected promptly. Then the next factors need to be considered. So this is a kind of a flow chart in which we can work for a patient for a gastroparesis if we have been confirming that with a test that the patient is having gastroparesis. So dietary modification, blood sugar control, maintenance of water and electrolyte balance, then prokinetic therapy, then targeted whatever therapy we have chosen, like jejunostomy or gastrostomy decompression, whatever has been required, if in all surgical procedure is required, then opting for it. So itself gastroparesis is a big complication, but it might give other rise to other complications like severe dehydration due to vomiting, malnutrition as a result of poor absorption. There can be blood sugar abnormalities, reduced quality of life, bacterial overgrowth in the stomach due to undigested food, and hardened or undigested food that can form solid mass, which can sometimes be life-threatening. So this is a very interesting study which has in the recent past been come out that the patients who are having gastroparesis, they have a risk of developing eating disorders. So patients with gastroparesis, this study was like typically indicating that gastroparesis diagnostically typically proceeds with the onset or avoidance of restrictive behaviors. So this study was referred for symptoms indicative of gastroparesis, which revealed that 55% of these patients exhibited signs of feeding and eating disorder known as avoidant or restrictive food intake disorder. So this was characterized by feeding and eating disturbances that results in the failure to meet the nutritional need, leading to low weight, nutritional deficiencies and dependence on supplemental feedings or psychosocial impairment. So these studies actually support the notion that individuals with gastroparesis are at risk of developing eating disorder. Therefore, it is very, very important to take this into consideration while we are working with the patients who are being diagnosed with gastroparesis. So let's come to the nutritional therapy for gastroparesis. So this was a recent study of 2022, which has shown that dietary intervention for gastroparesis, this was a systematic review, and they have basically studied different dietary interventions as the first line treatment for gastroparesis, and the efficacy of the different whatever they have reached to the conclusion, the efficacy of the different diets was still unclear. This systematic review suggested that low-fat diets, small particle diets, diet with isoflavones, and foods considered bland or starchy, sweet and salty did not exacerbate GP symptoms. So small particle diets and diets with isoflavones were found to improve the gastric emptying time in patients. Additionally, small particle diets were shown to reduce the anxiety in comparison to the large particle size diet. And of the randomized control trials, 80% of the low risk bias and 20% were fair risk of the bias. So the observation study was, actually proved that potentially to improve gastroparesis symptoms and gastric emptying in adult patients, particularly low fat and small particle size works better for such patients. For pediatric gastroparesis, the data was lacking and limited data was available for highlighting a critical gap in the literature. So when we were normally talking about the gastroparesis treatment into our hospital, generally from last many years, we've been just following certain basic rules after screening and assessment and making a tailor-made diet, that we will be reducing the fibers in the diet, the fat in the diet, making it a lactose free, or making it easily digestible, small frequent meals which have been given. But in recent past, this focus has been changed to the small particle size diet. And this was in recent years, the focus has been shifted to this, modifying the consistency for small particle size, which includes food that can be easily broken down through blending, grinding, mashing, mincing, and chopping to optimize the tolerance. So the ACT guidelines now formally recommend the small particle size diet, supported by the findings of two main studies. The first was using this diet as investigating the gastric empty time and postprandial blood sugar glucose levels in the patient of type 1 and gastroparesis compared to the healthy controls. So the subjects consumes, both the groups were like given similar amount of macronutrient profile, each providing 375 calories, 26 gram of protein and 13 gram of fat with 38 grams of carbohydrate and 4.8 gram of fiber. So the result was the patient with gastroparesis, the small particle size meal significantly improved or accelerated the gastric empty time compared to the large particle meal. So additionally, the study also suggested that the particle size could contribute to the improved glycemic control for diabetic patients too. So now the focus is not only modifying the meals as such, but the modifying the consistency of the meal is very, very important. So this was another very, very interesting study which has been there. So this study was a randomized control trial, and this compared the effects of dietitian directed meals of small particle size as compared to the standard diabetic diet on gastric emptying. So secondary outcomes included the effects on the diet on the body weight, nutritional intake, metabolic control, mental health, and quality of life. So these different diets were included in the study. One group received a reduced particle size meal, which was already processed into small particles. Another group received that can be easily broken down into small particle, and a control group received a diabetic diet, which controlled normal size particle. For all three diets, the macronutrient contents and the calories were all same. The results of this study supported that the smaller particle size improved the gastric emptying time as well as the symptom, and the emptying percentage was 120 minutes. It was improved compared to the control, as well as the symptoms like nausea, vomiting, postprandial fullness, bloating, and all were all improved. Also, after 20 weeks on the diet, the nutrient intake and the glycemic control stayed as compared with the typical diabetic diet. So, if it has been a dietitian guided diet, then it would be working well for these kinds of patients, the GP patients. So, quickly I will go through that. We first need to go for nutrition screening and assessment. The complete nutritional assessment needs to be taken care. Identifying and preventing the patient at the risk of malnutrition, that we need to identify at the beginning while we are going to treat the patient. We need have the ability to address the nutritional deficiencies and promote optimal nutritional status. We need to work on restoration of fluid and electrolytes, provide nutrition counseling and individual diet recommendations, improve the glycemic control in case of diabetic gastroparesis, and screen for the eating disorders like AIR-FID, which we have discussed initially also, and addressing the patient's individual and mental health as well as the quality of life. So psychological aspect is also very, very important into it. Then the roots of nutritional therapy also works. I mean, they also have a very good impact for treating the gastroparesis. So nutrition support can be enteral and parenteral, but studies indicate that enteral nutrition is an important measure to promote the recovery of the gastrointestinal function and maintaining the mucosal integrity and immunity and lessen down the complications. So in recent years, the use of PIC, that is the peripherally inserted central catheter, have also become well established in case it has been guided. But then it has also been, related with complications such as pneumothorax or large vessel perforation and other infections. So it has now become, though convenient, safe and effective way, but nutritional support, this long-term intravenous nutritional support, if required, then only is to be shifted to PIC. Otherwise, the enteral nutrition needs to be concentrated on, or the oral therapy if it can be maintained with the small particle size as we discussed. So enteral nutrition can be administered by oral intake also, and patient with gastroparesis can include small frequent meals with low fat and soluble fiber, and the particle size can be considered into it providing an early nutrition, which can be both can be combined with also, like the enteral and the oral nutrition. When the patient is able to tolerate a good amount, then we can typically see the prognosis and then decide for the effective treatment for the gastroparesis. So enteral
Shilpa,
nutrition.
sorry, last 2 minutes.
Okay. So the rate of enteral nutrition infusion should be gradually increased as we have been doing. So it has to be more of like continuous feeding if we have been doing. That works better for these GI symptoms to be on the reduced side. Patient with diabetes and hyperproteinemia, they need to be worked for. We need to have an effective control of blood sugar if we need to control on the gastroparesis. So the management of goals is relief of the symptoms, which we have been working on, and improvement of the gastric emptying time, glycemic control, and in mild disease, maintaining oral nutrition therapy is the goal of the therapy. So it is a gold rule, like we need, if the patient can tolerate with this, then we should work first on the type of meals and the content of the meals which we have been working. Then psychological comforting also helps into gastroparesis. So all the anxiety, fear, and the patient, whatever has been going through with this kind of issue, when the digestive issue, they can be better reassured by limiting these negative emotions and improving the quality of life. So I've already worked onto it. Just working on to last slide, that how does a small meal look like. So we need to first experiment individually with the patient, whether we need to go with small particle size or liquid meals or solid meals. It will be very, very individualized as per. Oral nutrition supplements can be used in the form of smoothies or protein powders and other things which can be blenderized. Solid meals will be only tolerated once the patient has an improved symptoms. So if nausea, vomiting and all are being, all a patient has been all through with that, then can have oral intake better, then these things can be considered well. And reduce dietary fat and avoiding high fiber foods works well for all types of gastroparesis patient. So we need to choose the food accordingly. And main tip is that we need to ask the patient or counsel the patient that they need to fill up the nutritious foods on the list first. So whatever has been advised, a low fiber, a good amount of carbohydrate and a protein intake meal with a well balanced of micro and macronutrients, that should be suggested with good amount of hydration, which is also very, very important for the patient. And the timings of the water or fluid intake patient should be guided for that. So small lifestyle tips which can be given for a better gastroparesis friendly diet, that can be considered, and some light exercises, walking, not to lie down immediately after meals, and blenderizing or small particle size, how to choose the food into it, these can be considered for the patients. So gastroparesis is a common complication after abdominal surgery, and there is no specific treatment for it, and nutritional therapy plays a very, very important role for these patients. So now new therapies for managing gastroparesis are being there. So particle size, which I have recommended, like from the various papers which has come into highlight nowadays, should be kind of aim to treat the gastroparesis symptoms, and ensuring the calorie goals which have been met, and the macro and micronutrient deficiencies to be prevented. Specific diet interventions hold the potential to actually ameliorate the symptoms also, and to enhance the gastric emptying with the diet of these small particle size. So optimizing nutrition is a multidisciplinary approach for patients with gastroparesis, and should also include screening for eating disorders. That is also very, very important. So more research is though needed, but to the time, if we have been following these kinds of practices, this will definitely help the patient for the gastroparesis to work or have a good quality of life. Thank you.